Closing the clinics is not going to stop abortions. Women are going to have abortions. It's just that they are not going to be safe and legal.
Over half the states in the United States right now have TRAP laws. TRAP laws are targeted regulation of abortion providers. These are laws that states pass that they're not a general law that might apply to all doctors in the state or even all OBGYNs in the state. They just zoom in on doctors who provide abortion services, and they're designed to make it hard for them to provide those services. In the past 3 years, there have been hundreds of restrictions passed, more than in the past decade combined.
HB2 happened this last year, which just basically was enough to really crumble the service infrastructure completely by requiring physicians to have active admitting privileges within 30 miles of the clinic, with restricting the dosage and the route of administration for medication abortion. So basically it means that every woman has to come in for 4 different visits with the same physician, with restricting abortion over 20 weeks. And then the pending regulation that's going to require every single abortion, even the abortion pill, to be done in an ambulatory surgical center. The combination of all those things, we're going from 44 clinics where, highly trained physicians were providing abortions in a licensed environment down to 6.
Well, now HB2 is in full effect, so our call volume increased tremendously in one day. I mean, we saw our call volume double, if not triple, within a matter of hours, because all of the patients are now getting those calls saying, yes, you had an appointment scheduled today, but unfortunately, I cannot see you today. You can only imagine that if you have 500 women to get into 6 clinics, there's a waiting list right now. There's a 2 or 3 week waiting list for women for a procedure where time is of the essence. And this is our operating room. And the question we hear from patients all the time is, are you gonna cut me? Am I being cut? Because that's what an operation is, You hear that more times than not, unfortunately. This is the same exact building and the same exact setup that you would bring someone who's having open heart surgery. No different. No different. Same exact setup.
Whole Woman's Health is the lead plaintiff in the lawsuit against the state challenging the ambulatory surgical center requirements. At the same time, we're scrambling to try to figure out, is there a way we could stay open? I can't do one without the other. I can't raise money to help people travel by bus for 500 miles round trip without challenging the law at the same time, because the Band-Aid isn't gonna work. For a lot of women, one of the biggest reasons they end up seeking an abortion in the first place is because they can't afford to have another child. Most of our patients already have a child. They're already working poor, either single or married moms, and they're seeking abortion because they know very personally exactly what it takes to bring up a child. It's not like something abstract, it's something they live every day. With each restriction, we see a larger and larger group of women sitting over here who can't do it. I can't come for 2 visits, I can't get 2 days off work, I don't have enough money for a hotel, I can't travel. With the closing of our McAllen office, we're seeing a large spike in women who can't make the journey north to San Antonio.
One second. Marva.
It's a 13-year-old rape victim that's 20 weeks. They should always call about a 13-year-old rape victim that is 20 weeks pregnant. There's special things that need to be done for her.
Looks like Shayla made an appointment for a 13-year-old minor today in San Antonio coming from McAllen.
We had a 13-year-old who was referred to us from McAllen, and she is right at the cusp. She's 20 weeks and 5 days today. And in order to see her, I need to put her to sleep. And in order to do that, I need a nurse anesthetist. And because of this crazy law, it is impossible to find people to work for us. People know that our work environment is unstable. And so now I'm down to one lone certified nurse anesthetist. And I'm basically held hostage by her schedule. And if she can't be there, I can't see patients. And unfortunately, we have to turn this young girl away because I don't have anybody to put her to sleep. And she's 13 years old, and she is a victim of rape, and she drove 4 hours from McAllen to San Antonio, and we had to turn her away. And there was nothing I could do to save her. And so now, if she has a procedure, and that if is huge, she'll have to go all the way to New Mexico and pay $5,000 and get there and spend 3 days. It'll never happen. We know it won't. In those cases, I feel like it's an automatic sentence to parenthood. We sentence her to motherhood because what are the odds of her making that trip? It's not likely.
10 days ago, we filed for a stay of the U.S. Court of Appeals decision, which would allow the Texas law to go into effect and would close all but 8 or 9 clinics in the state. So we're just hoping and hoping every day that we get an order from the Supreme Court. It's very much sitting on pins and needles while we try to figure out what's happening.